Good evening, everyone. It's my real pleasure to be presenting this abstract in this eminent conference. My name is Mohamed ElMaghawry. I'm one of the electrophysiologists in Cairo, Egypt. I work at LEADLESS hospital, and today we are presenting our early results of leadless pacemaker implantation in Egypt. This is our single operator report. This abstract was done by myself and my fellow, Dr. Mohamed. We both work at LEADLESS hospital. Leadless pacemaker is an emerging pacing modality for some cases that require an alternative to traditional transvenous pacing. The data regarding real-life indications, implantation details, and follow-up of leadless pacemaker in low and middle-income countries, like most of African countries, are unknown. We report the data regarding the first series of patients implanted with leadless pacemakers in Egypt. Our methods, we collected the demographics, clinical indications, implantation data, including procedural time, procedure-related complications, and programming parameters at time of implantation, and 1 month follow-up are collected retrospectively from my registry as a single operator. So far, we have done 25 patients, 13 of which were females. The mean age was 66.5 years. Youngest was 30 years old, and the oldest was 88 years old. All implanted devices were done with the Medtronic device, the Medtronic leadless pacemaker system, which is the Micra system. We had the VR Micra in 13 patients and the AV in 12 patients. Our results showed that the main indication for the implantation was bilateral pocket infections, and that happened in 12 cases. Other indications included end-stage renal disease in 6 cases, bilateral chronic venous obstruction in 4 cases, device-related infective endocarditis in 4 cases, and 5 cases were accompanied with concomitant lead extraction procedure. Our average procedural time was 52 minutes. The first good position, meaning that we didn't need to change the device position, was obtained in 16 out of 25 patients. There were no deaths, no vascular injuries, and no pericardial effusions. At time of implantation, in 1 month, average right ventricular R-wave sensing was 7.4 millivolt and 14 millivolt in the follow-up. Average right ventricular pacing impedance was 650 ohms and 540 ohms in the follow-up. Average right ventricular pacing threshold was 0.5 volts at 2.4 milliseconds and 0.35 at 2.4 milliseconds in follow-up. In our conclusion, real-life data showed that leadless pacemaker is a safe and effective alternative to traditional transvenous pacing. Thank you very much.